The numbers indicate Utah's efforts to stop the coronavirus may be having a positive effect. But still, it's hard to know because there could be people with the virus who have no symptoms but are contagious and are spreading it. And because CDC guidelines only allow those with symptoms to be tested, the question remains, do those guidelines give us an accurate picture of the spread of the disease? That's where I started when I sat down with Lieutenant Governor Spencer Cox, head of the Utah Coronavirus Task Force, and asked him 3 questions. Is there anyone here in Utah or elsewhere who's coming up with other guidelines that can guide us toward those folks who are asymptomatic and who have not tested positive and are still contagious?
While it is true that you can pass the disease asymptomatic, the odds of it happening are actually very, very low. Most of the time, this gets passed because of droplets, and those droplets come out of our mouths onto other surfaces when we're coughing, sneezing, and we're sick. And so, by testing as many people as we can who have those symptoms, and then finding out, this is the contact tracing. So testing is the first part. Contact tracing is the second part. Everyone they've been in contact with over the past few days, we test them even if they're not symptomatic to see if they have it. Then we can quarantine those people. That's how you get ahead of this disease. That's how they've done it in South Korea. That's how they've done it in China. That's how they've done it in other places. Is they can't test everyone. And so when someone is exhibiting symptoms, now the good news is we should be able to start testing everyone exhibiting symptoms. Until this week, we couldn't even do that. We could only do it if you had symptoms and you had been in contact with someone because there were just so few tests left, or you were in the hospital, something like that. So that's what's changing this week, and that is our strategy over the next month and beyond. Is we test everyone who has symptoms, and then we look back and find the 50 people they've been in contact with over the last week, since just before they started exhibiting symptoms. We test them, and we quarantine everyone who tests positive, and we stop the spread of this disease.
The governor has said that he wants to flatten that curve that we've all been talking about, and now we are hearing that that is starting to happen. Does that mean that we are moving farther away from an everyone stay home order?
Well, we would all like to avoid that, and the only way to avoid that is if everyone is doing their part, as I mentioned earlier. If we're doing that, we may be able to avoid an everyone stay home order. And so, yes, if we can show that curve is flattening and we're not seeing the exponential increases, that's exactly what we're looking for. Remember, we were the first state to implement a reduction in mass congregations. Nobody over 100. We were the first state to do that. We were one of the first states to suspend our schools. With the delay that comes from getting infected to seeing the results of that infection, we're just now starting to see the results of ending those mass gatherings. And so that's why you have to wait a couple weeks to find out if the decisions you made 2 weeks ago are actually working. And we're hopeful. The signs over the last couple days show that we've kind of leveled out. We're having about close to 40 to 50 people that are testing positive every day, and we're expanding our testing at the same time. So that's good news. We do expect, though, that as we significantly increase the number of tests, we are going to see an increase in positive. But those are people who were not getting tested before, and they were still getting the disease, but we just didn't know about it. So we expect an increase in those numbers, but we're hopeful that the decisions we've made will allow us to level off, not overwhelm our healthcare system, and not need much more stringent measures. But if it doesn't happen, we will have to take those more stringent measures. So please, 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 people, take this seriously.
Every day there is a state briefing, an update, and every day there is a federal briefing and update. How do you prevent information overload when we get into a situation like this?
Well, communication is always the most important part and unfortunately the most difficult of any type of crisis. Even in the best of times, communicating is very difficult, especially because we have so many ways of getting our information now, right? Social media, the cable news, everybody gets to pick and choose whatever they want to hear. And unfortunately, it usually is whatever fits their worldview. And we don't hear sometimes contrary views. So we are working very hard. What we hear mostly from people is they're really starving for data and information and accurate information. And so we want to provide that accurate information to them. I would caution people from over consuming that information, though. It's not healthy to be engaged in the news and social media all day long. I've encouraged people, I said today, turn off social media, exercise, call a friend, take a break and pause and look at the beautiful things around us. Try to find the good in the world around us so that we don't get overwhelmed. But just know that there are trusted sources where you can go, and coronavirus.utah.gov is the best source to get information about what's happening here in the state of Utah. And we're updating it multiple times every day.
Lieutenant Governor Spencer Cox, head of the Coronavirus Task Force here in Utah, thank you so much for being part of 3 Questions.
Thank you, Bob.